wait a minute here. I think Commissioner Heimball got shut off. I can go ahead and call the meeting to order. We do have a quorum. Commissioner Heimball is trying to log back on. Welcome everybody to this April the 21st, 2020 meeting of the Garrett County Board of Commissioners, our second virtual meeting here on Facebook Live. I want to welcome everybody and thank all of those who logged on to check us out today. Just a couple of real quick announcements before we begin. If anybody would like to make any comments or reach out to us on any of the agenda items, they can always go to gccomments@garrettcounty.org. Once again, that is gccomments@garrettcounty.org. The same place that we try to take commentary on a lot of the things that that we bring up. We don't have a large agenda today, but we do have a lot of updates, and I think a lot of updates that people will be interested in hearing as we move along. We do have some guests with us today as well. Excuse me. We have Bob Stevens from the Health Department and Steve Frotz from the Election Board. That'll be bringing some updates to us as we get started. We'll go ahead and approve the agenda as we wait. So, Mr. Knoll, do we have any additions, corrections, or changes to the public meeting agenda?
No, sir, we do not.
All right, we do not. So do we have a motion to accept the agenda?
So moved.
All right, we have a motion. I'll second that motion. And we'll go ahead and approve the agenda by mutual consent. And I'll also, I guess we better wait for Commissioner Heimball to approve the minutes just to make sure there's no concerns there. And while we're waiting on that, I'd just like to say that I hope everyone is safe and the families are doing well as this continues to unfold. And I'll remind everyone that our next meeting is Monday, May 4th. And hopefully it won't be the same as this, but I'm sure it will be.
Commissioner Heimball?
Yeah. Commissioner Heimball, are you with us?
I'm got audio, no video at this point.
All right. All we did so far was approve the agenda. And everyone got a copy of the minutes in advance of the meeting. Are there any questions, corrections, or concerns with the minutes? Hearing none, we'll take a motion to approve the minutes. We got a motion. We have a second.
Second.
All right, we got a motion and a second. Minutes are approved by mutual consent. And that'll move us right into the updates. And first item on the updates, we have Bob Stevens with the Health Department and a summary of local orders. Bob, go ahead.
Okay, thank you for giving me the opportunity. And the first thing I want to say really has to do with the fact that we're having some technological problems. So I really appreciate all the work the commissioners are doing to bring broadband into Garrett County and doing everything we can to get us started. The one thing I really want to do also is to thank the community, the residents of Garrett County and your leadership, because the things that we are doing to prevent COVID-19 from really spreading in Garrett County so far really are working. And that's the bottom line. It's working because in Maryland, we've had over 14,000 cases and there are 584 deaths in Maryland. And our goal is to protect our most vulnerable population. And so currently where we are, we've had 148 negative tests and only 4 positives, and there's no indication of any community spread. What I did want to do is give you a little bit of an update first on what we're doing here at the health department, and then talk a little bit about testing and some of the executive orders, and then also the transient vacation rental. So for the health department, we have about 80% of our staff are teleworking, and that's working out very well. We're able to continue to operate. We have about 20% of our staff are usually in the building. We're providing essential services. A lot of the staff who are working on COVID-19, what we're doing is we're educating providers and collaborating with the county's emergency operations center, working with the long-term care facilities, those nursing homes, Garrett Regional Medical Center, because those are the real partners that we need to have involved in the event that there is spread in Garrett County. We're trying to provide as much education and awareness to the public as we possibly can. Investigating complaints. We don't investigate all the complaints. A lot of the complaints are investigated by law enforcement and specifically the Maryland State Police. But some of those that are health related, we do investigate those. We continue to monitor the situation, and we do something called contact tracing. And I'm going to talk a little bit about that later. The governor, though, he listed contact tracing as one of the 4 predicates that we need to have in Maryland before we can open things back up. And that is that there needs to be widespread testing to make sure that they're catching everything coming in, and then also being able to make sure that that it's no longer being transmitted in the community so much. And the governor has been able to acquire 500,000 test kits from South Korea. And that's a great feat on his part. And that's going to put Maryland at the front of being able to have those testing kits, although there still will be a backlog somewhat from the labs because the labs still have to process. The other things that need to be worked on is to be able to deal with the capacity of a surge in the event that there's a lot more people testing positive. And so they're getting hospitals ready and temporary facilities ready throughout the state, mostly in the central part of the state. There needs to be enough personal protective equipment for our medical providers, law enforcement, again, those long-term care facilities, to make sure that we protect those people who are trying to provide the services. And then once again, the contact tracing. But let me talk to you a little bit about our testing. We work with quite a few different practices in the community are ordering tests. Some of them are providing the test outright. And then we also have Garrett Regional Medical Center, which is doing an outstanding job of having a drive-up testing site, although at this time, everybody has to have a doctor's order to come through. So we're really trying to monitor that and put our information into the national surveillance system. One of the things, if you go to the Maryland Department of Health, or if you go to the Johns Hopkins website, you're going to notice that Garrett County has had a lot fewer cases than other counties. We only have 4 cases. Somerset County has 11, but most of the other counties have a lot more. And one of the real reasons for that is that over 2/3 of the long-term care facilities in the state of Maryland have had outbreaks, and none of our long-term care facilities have. And we have been working very hard with them to try to prevent that from happening, because once it gets into a long-term care facility, it spreads pretty quickly. And those are a very vulnerable population, very vulnerable people, and we need to protect them as best we can. I want to talk a little, to you a little bit about the executive orders that the governor keeps coming out with. So far, I've counted that he's had 29 executive orders. Every time there's an executive order, our hotline, people start calling our hotline. They usually call it the hotline within about 5 minutes of the governor announcing the executive order. And by that time, we've just heard about it at the same time as everybody else. So everybody's wanting to know what it means, what those executive orders mean. And we usually need a couple hours to try to sort that out, to provide that information back. If people do have questions, they can call us. And if we don't know the answer, we'll point people in the right direction. I did want to bring up the cooperation that we've had with our real estate agencies with regard to the transient and vacation rental units. As most people are aware, that was one thing that we did here in Garrett County. Was we saw the vacation rental units as a non-essential service, where lodging is essential, because if we have visiting nurses, or we have people who are their car breaks down, or even if we have a bad windstorm and we need to have linemen to come into the county, they need someplace to stay and they need someplace for lodging. But those are normally not people that are staying in the hotels and motels. With the people who are coming to the vacation rental, that's just by definition a recreational activity. And so the real estate agencies have worked very well with us, although we are aware that there are some owners who are renting kind of clandestinely, and we work with the Maryland State Police to try to check those things out. Do want to let everybody know that owners are allowed to come to Garrett County. They own property here. They pay taxes just like everybody else. So the owners are allowed to travel here, but they are not allowed to rent those units. And so there's only a few that are out there, but there are people that are out there that are trying to take advantage of this. And so we try to track that down. We did work very well also with the Deep Creek Lake property owners and the Friends of Deep Creek Lake to try to get information out to all those people who are property owners who are care very much about Garrett County, and to provide them with the information that they need in order that they don't find themselves in a situation they don't want to be in. And so we advise them to do some things like, if they are planning to come to Garrett County, it should be for a longer length of stay. It shouldn't just be coming down for the weekend and then going back and then coming down again, because if they do that, they're increasing the likelihood of the spread of the virus. If they come down, they need to self-quarantine. They need to bring their food with them and supplies with them, so that they can self-quarantine instead of coming in from some distant location where they may be asymptomatic and bring the virus with them and not know it, and go to a store and pick up provisions and then spread it inadvertently in the community. We also wanted them to let them know that there's universal masking that is in place here in Maryland, and let them know about that if they're coming down, the recreational boating on Deep Creek Lake is that the DNR has prohibited the recreational boating, and so we're really trying to provide that information as much as possible. So does anybody have any questions?
Bob, I've got a couple questions for you in relation to testing.
Sure.
Several people have reached out. One common question, and if you mentioned this earlier, I apologize. My audio has been going a little bit in and out, but why does the testing take so long to get results for? I'm hearing from people that it's been 12, 13, 14 days that they got their test, or their loved one got a test, and they haven't got results back yet. Can you address that?
Okay, so first of all, that is true. Early on, that's how long it was taking. we're hearing that it's taking a lot shorter period of time now. Garrett Regional Medical Center has for people who are in the really high risk population, which is if they are a medical provider or if they've been admitted into the hospital, they're able to work with West Virginia University and try to turn those around pretty quick because WVU has their own system. But if they have to work with LabCorp or Quest or one of the other commercial labs, they're just being inundated with the tests. And originally it was we had situations where it was almost 2 weeks to get the test back. We're hearing though now that it's down to about 2 or 3 days. During that time, people do need to isolate, and because if they're asymptomatic and if they isolate and then the test comes back and says that they're negative, then they can kind of resume whatever that normal life is now. I mean, they still have to wear all the masks and do all those types of things, but they may not have to isolate. So it is catching up, and so hopefully that as more labs come online and as there's more capacity, that will shorten.
Bob, is there anything, not to press the issue at all, but is there anything we as a county can do to help expedite the testing results? And the reason, I mean, obviously the people that are being tested want to get the results back as soon as they can, just because they're going to be in fear of the unknown. But as the governor keeps talking about and the president keeps talking about, the key to reopening things is going to be the availability of testing and therefore the getting the test results. Is there anything that you know of that we as a commission could do to help you and those in your industry expand and expedite that testing?
So offhand, I'm going to say for the general population, that's very difficult because of the limited capacity of the labs that are reading the tests. We can get, and I'll just let everybody know that we have reserved some tests that are here in order to work with the state lab in the event that there is an outbreak at a nursing home, because we need to get those tests back in 24 hours. And so the state, we would have to drive those tests directly there. We only have a limited number, and the state lab, once again, they can only process about 500 per day, but they would put that on a priority. If we had an outbreak in a nursing home, for instance, we would put a real priority on that. But for instance, if I was tested today, the best thing to do is just to work with your provider and see what the turnaround time is with the different lab. There may be a difference between the different commercial labs, and each provider contracts with different labs. So the consumer, the patient, may want to call and say, well, do I want to go to the urgent care or do I want to go to my doctor's office? Which one's going to get the lab result back faster? Okay.
And you had mentioned earlier about the governor getting the test kits from South Korea. Are any of them going to make it out to us? And I guess then to follow up to what you said, it may be irrelevant if it seems to me we have enough tests. It's more for Garrett County, the turnaround time on the test results. Would that be accurate?
Yeah, I am sure some of those tests are going to make it out here. That there is no state in the country that has done 500,000 tests.
Yeah.
And so Governor Hogan is really to be commended for that, for being able to get that. And so that, I think our population is about 6 million. And so if you get 500,000 tests, that's 1 in 12 people being tested. So they can probably lower the threshold for people who are asymptomatic, or maybe they're worried because they have a little bit of a cough, but they don't have a fever. In the past, those are probably ones that wouldn't have been tested, but in the very near future, they'll probably be testing people that may only have one symptom.
Hey, Bob,
Yes.
quick question. read somewhere that maybe 500,000 test kits were not actually complete test kits. They're still maybe they're missing some of the components, and so they don't actually have the complete test kit to use. Is that correct?
Did you catch that, Bob?
I think so. It sounds like Jim's on a moon mission, on he's in a space shuttle or someplace. But I'm not certain if all the media is included in those kits. I am not I'm not a chemist, so I can't tell you exactly what all is involved. But I know that they need to have. Sometimes there's not enough of the swabs left. Sometimes there's not enough of the viral media that's left. Sometimes, it's the transport media that they need. And so they need to have all those pieces together. And so one breakdown can delay that. But by being able to lay their hands on it, even if they're 500,000 partial kits, that puts us ahead as a state. And really hoping that we can, Maryland can open up quicker than some states.
And the last question I have for you, Bob, and I really appreciate you taking the time and really appreciate everything that you guys are doing because, I think the proof's in the numbers. I think Garrett County's handled this fairly well, and you're to be commended for that. We see that the number's on 4, but because of the reporting, we do know there have been a few more cases in the county that don't show up in our numbers. Do you want to address that? I mean, trying to give the people an accurate picture of exactly what we're dealing with, but even with those, we're still under 10. Is that correct?
Oh, absolutely. I'm aware of 3. And there could be others because what happens is when somebody is tested at a physician's office, and let's say they live in Terre Haute or Kingwood, that result will go to the physician's office, but it won't necessarily be reported to us. The only thing we get is through the National Data Surveillance System. And so we know of at least one person who tested here who was from West Virginia. We know of one person who tested here who was from downstate, and they self-isolated. We helped that person. We gave that person a quarantine order. They did a very good job of isolating, and they're back home downstate. There could be some other folks from time to time if somebody is in a state facility or whatever, that there could be somebody there that is not a resident of Garrett County. But again, the overwhelming point that we want to make is every case that we've seen was associated with somebody who was outside of the community that came in. And we did this, what's called contact tracing, where our staff spend probably an hour interviewing the person who is positive, finding every person that they have been in contact within the last 14 days, and then calling those people and asking them how they are feeling, and tell them that they've been in contact with somebody who did test positive, and begin to really put a bug in their ear that to call us. And then we follow up by calling those people or texting them nearly daily to say, are you still feeling okay? Have you taken your temperature today? Because that's the way you have to stop this transmission, is by reaching out and doing that. If we can't have a quick diagnosis, and that's why the testing and the turnaround time from the lab is so important, and then following up with telling those people who have been around somebody who tested positive, you need to isolate yourself so that just in case you're not going to inadvertently spread it somewhere. And again, what keeps us awake at night is any place where you have a group of people living together in some type of a group facility, a long-term care facility, even the jail. I mean, those are places that we're afraid that if it spreads there, it'll go quickly.
All right, any other questions for Bob? Thank you, sir. We appreciate it.
Okay, well, thank you for what you're doing.
Hey, Kevin, you're on mute. Kevin, if it's, if unless you object, I'm going to go ahead, since we've got Steve Frotz on the line here from the Board of Elections. I'm going to let him go next with his update, and that way, if he wants to get off, he can.
Sure.
All right. Steve, thanks for jumping on with us. We appreciate it. Can you hear me all right?
Yep, I can hear you good.
All right. You want to give us an update on what's going on with the election and that, all that stuff?
Sure. Thanks for letting me chime in here. As you know, we're just sitting and waiting as it comes down from the governor, and we just keep responding to every day, it seems like. But today, what I know of right now, we're starting to get some things in plan to conduct this upcoming election. Of course, according to the governor's proclamation, he moved the election from April 28th to June 2nd. And then he gave the task to the State Board of Elections in correspondence with the local elections as well, to give him an idea of the best way to conduct this upcoming June 2nd election. So in another proclamation, the governor has said that this election will be primarily a vote by mail. So starting May 1st, I'm going to put it down into our terms in Garrett County here. Starting May 1st, all Garrett County eligible registered Republican and Democratic voters will automatically be mailed a ballot for this election. So all ballots will include a postage paid return envelope for voters to return their ballot by mail. There will also be a ballot drop-off receptacle 2 weeks before the election located at the Oakland Community Center. And then for voters that are unable to vote a mail-in ballot, we will have a vote center open on election day only from 7 a.m. to 8 p.m., also at the Oakland Community Center located at 14th North 8th Street in Oakland. There'll be no early voting or no election day polling places open. So the only vote center we'll have is at the community center. I just want to reach out and encourage all Garrett County voters that maybe haven't voted for a while or has recently moved to check their registration status. That way they can assure that there won't be any issues of getting their ballot by mail. They can do that either by going to www.elections.maryland.gov and checking it online, or they can just call the office at 301-334-6985. So the deadline to register to vote or to make changes to your voter record is May 27th. So we have a month, but if the ballots come out in May, you know, time is kind of the essence to make sure voters know their registration status. All applications are located at all the post offices in Garrett County. Of course, you can do it online at our website, garrettcounty.org/board-of-elections. But I want to reiterate that Maryland conducts a closed primary election, which means since Garrett County does not have a nonpartisan ballot, only Republican and Democratic voters will be eligible to vote in this primary election. So that's another reason to check your registration details, because in the past primary elections, you know, a lot of unaffiliated or other parties wants to come and vote, and they're just not entitled to. So they have up till May 27th as well, if they would be interested in changing their party. There's a lot of election processes and protocols that are still, the ink's still not dry, so we're changing daily. But for everyone out there, that's basically our upcoming election in a nutshell.
So,
So any of you have any questions?
yeah, Steve, so the ballots will be mailed out to residents when?
Starting May 1st.
And then once, so when I get my ballot or anyone out there, it's a citizen, when they get their ballot, then they can fill it out and mail it back right away. They don't have to wait till election day to do that, correct?
Correct. We're wanting, the reason why we're having a vote center is for the individuals that maybe can't vote a mail-in ballot, possibly maybe someone that has vision impairment or someone that needs assistance or someone that just registered, by May 27th and didn't get a ballot. So that's the main reason we're having this election day. But we're encouraging voters to vote by mail, be safe, to protect themselves and, of course, our election judges that's got to have human contact on election day. We're going to do every provision we can. We'll be in the gymnasium at the Oakland Community Center. It goes by square footage. It doesn't mean 10 per room. It just means whatever square foot that is. And I'll probably get with Bob here as we move forward, see how many people I can have in that. But I'm going to try to keep everyone involved in the election as safe as possible, including my staff and I.
Sure. The one thing I would ask Kevin, can you get with Steve and maybe do a press release on exactly how this is going to operate, so people that aren't able to be on this paper or whatever will have that information early enough, because I'm sure as we get closer to election day, more and more of these questions are going to come up. So the more information we can get out to people, I think the better.
Yes, I'm sure Sarah was taking notes, and we'll get on social media and our website.
Okay.
And Steve, if there's anything we can help you do to get the word out, let us know.
I appreciate that. Well, I'm still kind of waiting from an official press release from the state. They're working on it. They want all counties to convey the same message. And I did put a blurb in the Republican this week, but just basically what I'm telling you guys today and whoever is in attendance. But the actual state will be issuing us a release here shortly, and I'll make sure I forward that to you guys as well.
Okay, great. Thank you. Any other questions for Steve? All right. Hey, Steve, thanks a lot, buddy. Appreciate it.
Thank you guys very much for having me.
All right.
Stay safe.
See ya. Kevin, we'll go back to you then and talk a little bit about the EOC and some of those other things.
Yes, I'd just like to give a little overview of what's been happening around the county and our local response and assistance. So the EOC, of course, has been operational since the very beginning. Where we have coverage 24 hours a day, 7 days a week. We have either somebody in the center or on the phones. A lot of what we're doing is coordinating the PP, personal protective devices, PPDs. So they're responsible for procuring and distributing the devices throughout the county, whether it's to the rescue squads, the sheriff's office, and coordinating with the health departments to make sure the healthcare centers have them. As you can imagine, that's pretty big effort right now. We're getting those from the national stockpile as well as some state stockpiles. So we also, of course, it's a joint operation center with the health department, county operations. And I will say this has been a very smooth operation. This is somewhat different than what the emergency operations center normally prepares for. It's normally pretty active with whether it be a snowstorm or tornado or something like that. This has been kind of a slow moving, but there's been a lot of activity. And the health department and Bob's staff has been very, very helpful with that. Some of the other things that we've been doing in conjunction with the health department, there's a lot of interest in making homemade masks, and especially with this new requirement to wear a mask if you're going into the store. So the health department has coordinated a Garrett County volunteer portal And there's a group making masks at this point primarily for healthcare workers. You can go to the Garrett County Health Department website. It's garretthealth.org/community. And there you can click on whether you want to volunteer to make masks, to donate masks, to donate money, to donate food. So it's one source for volunteers in the county. Again, it's at the Garrett County Volunteer Portal at the Health Department. We've also worked with most of the towns in the county because there's another group of people that are just making masks and they want to give them out to people. So we've worked with the towns, and most of the towns have agreed to provide a collection point at their town offices. So we put bins or boxes at the town offices, and when the towns are open, and you need to check with the towns to see when they're open, some of them you can put the mask actually in their mail drops. But if you have masks you want to donate to the community, get to one of the towns, drop them off. The county will be picking them up, and then we're going to be working with local community groups, civic groups, and church groups to get them distributed out. These will be free of charge to members of the community that need them. So I'll also say if there's any civic groups or church groups that are interested in helping with that, contact us and we will get you on the list. And as we start getting these masks in, we'll get them out to the community. There's been a huge outpouring, and so we really don't know what to expect, but we are expecting a lot of masks in. Some other things, the Economic Development Department has been contacting businesses around the county offering our support. They did create a small business development loan program early on, so that's out there. They have been reaching out to business. We have a couple businesses in the county that are making masks for various companies, both in the county and out. And they have identified a couple companies that are interested in making ventilators. And we've provided that information to both MEMA, Maryland Operations, and FEMA. I'm not sure if they've picked up on that yet, but so we do have a lot of interest in the county, a lot of people that are willing to help. And finally, I'd like to say, county operations have really continued. We really haven't missed a beat. We're providing all essential, in fact, all county services. Most of our staff are working remotely. We're doing everything from building permits to inspections, of course, trash removal, all of our financing, all of our bill paying, purchasing, all of that is continuing. I'd like to thank the staff, particularly for what they've done and been doing, working from home. We turned this up pretty quickly, and I really don't think we missed a beat. Maybe things are a little slow here and there, but we are providing every service that the county normally provides. So I'm very proud of the folks we have.
All right, great. Thank you. Any questions for Kevin? All right, not hearing any. Let's move on. The next item on the agenda is fiscal update. Scott Weeks, our Director of Finance. Scott, what do you got for us, buddy?
Good evening. So Kevin sort of wanted me to give you an update on the budget process and how we're proceeding along with that. But before I do that, we're really challenged with this year's budget right now, and we're doing estimates on that. So I'm going to share a screen right now with you. This is a schedule that Senator Cardin's office asked for on estimating some of our losses. Can you see that okay? Is it up yet?
Yeah, looks good.
Is it any bigger or smaller? Does it look all right to you?
No, that looks pretty good.
Okay, so Cardin's office asked for this because I think the feds are working on the next level of funding, federal funding, to try to take care of some of the revenue losses. All the funding that's out there that we know of right now is to cover COVID expenses. And there's a ton of it out there, and we're trying to sort through all that right now. But I think the next level is to maybe help out on some revenue losses. So these are my projections right now. And again, I want to point out that this is changing, and it's changing weekly. By the time we get to a budget in May, when we go over the budget on May 19th, I believe it is, these figures could change by then. But I want you to focus on the first column right now. Income tax, that is the one that has got everyone baffled right now. I've been on regular calls with other finance directors across the state, with Mako and the director of the Bureau of Revenue Estimates, Andy Schauffel's the guy's name. I don't know if many of you know who he is, but he's the expert for the state on estimating revenues, in particular income taxes is what we're interested in. Andy's estimating that the state income tax withholdings will decrease about 22% each month that the shutdown takes place. We're using that same assumption for our budget model and to ride out through the fiscal year. So the schedule you'll see is for fiscal year ending June 30th, 2020. And then I'm also got some preliminary projections for next year's budget. All in all, I'm looking at about $5 million in the next 6 months of revenue loss. As you can see, I'm projecting accommodations, since everything's shut down right now, about 550 loss through the end of June 30th. Mission amusement, not much is going on there. If anything, right now, 100,000 loss in revenue. And then transfer and recordation tax right now, this is when all that picks up and the properties at the lake start transferring. We've seen a slowdown in the amount of deeds that are coming through. I do feel optimistic that we might pick up some refinances right now because interest rates are so low. So we'll get some of that tax back. And then interest income, I put 0 right now because right now you look at the trial balance, I just pulled it up. I budgeted about 450,000 in interest income, and we're tracking about 483 at the end of March. So any interest income from this point is, for lack of better terms, fluff money that will help absorb some of this 2.7. But to give you an idea of what interest rates have done, this time last year, I was earning about 2.43% on my overnight account. And today I'm earning about 66 basis points on my overnight account. So I'm only earning 27% of what I was a year ago. So anyway, I think the $1 million question, everybody is scratching their head that's estimating any type of revenue right now, is when's this thing going to end? You know, when's the shutdown? How long is it going to last? When's it going to end? And then the follow-up question to that is, how quickly do we think employers will respond? And how quickly do we think vacationers will return back to the market? So those are the questions that we keep asking ourselves, and nobody really knows the answer. So we had to build some assumptions into this budget model. I won't get into the assumptions for next year. I'll save that for the May date. And like I said, those figures might be adjusted by that date anyway. But really, I projected out through September. So if there's isn't some sense of normality by October, the figures will be worse than that, is what I'm telling you. Now, in saying all of that, I do think we have a good game plan in place. For this fiscal year in particular, we've sort of shut down all the unnecessary spending. Any capital projects that we could delay, we're delaying. Any capital expenditures that we could delay or not spend this year that haven't already been encumbered or committed, we're stopping that. I've been working closely with the Roads Division Chief, Paul Harvey. We're in daily communication. I'm looking over the trial balance right now, and there's about 900,000 in paving that we usually do before June 30th. Because we've cut back the roads department, we're saving on the expenditures there. I've seen the invoice flow really slow down there. I don't know all the savings there, but Paul was telling me that even if they went back full force today, they're so far behind on paving now that they wouldn't get to the paving part. There's so much preliminary work to do that they wouldn't get to the paving. So I'm pretty confident that we'll have that 900,000. There's some savings in our fuel account because the gas prices are down and we're not fully operational right now. I was looking at the trial balance and there's about $500,000 there that we can look at. We're cutting back on line striping. This is the time of the year that we do that. We're thinking we're going to save about 85,000. We're just going to line stripe the high traffic areas, the roads that we have safety concerns with fog and such. So we are making adjustments to the expense side to absorb a lot of this revenue loss. You'll see a lot of that in some of the budget decisions we make for next year too. But I won't get into all of that right now. So another thing, some of our revenue line items, we were actually tracking above budget prior to the shutdown. So we'll be able to absorb some of these losses through that as well. So
Yeah, I think, and Scott, I don't mean to interrupt you, but I think a major thing here for people to understand, because I think if you just look at this, you say, oh my goodness, we're going to be $5 million short. That $5 million is not accounting for a lot of the offsets that you're mentioning right now. That $2.7 million loss is a loss of revenue, but it's not a budget hit completely, because we are going to have a lot of those savings in things that we didn't spend during this time, in the things that you've been able to do. And people out there, and I'm going to pat you on the back virtually here. We've got a fantastic finance department, and dare I say, the best finance director in the state. But you've done a great job, and I just want people to know that the money's being looked after very well. And there is going to be a significant savings in fuel and capital. And when we're talking about capital, we're talking about those things that we buy, like paving, but also there could be some dump trucks or things like that we can defer, or whatever we need to do. I actually, in going over this with you yesterday, feel a lot better looking at this right now than if I would just be looking at these numbers without that context. I think we're going to navigate this better than a lot of counties. And certainly looking at next fiscal year, starting July 1, there's a lot of presumptions there that we don't know, but we're still positioned fairly well moving into next year, with the things that Kevin's been able to do and the hiring freeze and so on and so forth, that will help offset again as we move forward what may look like a very daunting task, and certainly not that it's going to be easy. It's not an ideal situation, but just looking at these numbers on this sheet of paper may make it look a little worse than what we actually think it is right now, based off of doing better than we expected up to this point in a lot of budget items. And plus the flip side of this is we're losing revenue, but we've also lowered our expenses. So I just think that's very important to clarify as we look at these numbers.
yeah, and I hope these numbers are conservative enough. I hope I didn't undershoot them by any means, but yeah. I'd be lying if I told you that everything was rosy and
Sure.
and I wasn't concerned. People have been asking me, are you concerned? Yeah, I'm concerned. Who wouldn't be? But my level of concern, I'm not in panic mode right now, because as you mentioned, we are positioned well. We have reserves in place, and I think we can try to ride this out and weather the storm. Our reserve level, if we have to dip into them, we will. That's what they're there for. It's called a rainy day fund, and it's certainly raining right now. But my hope is to absorb most of that, so we don't have to dip into the reserves. So that's pretty much that. I did want to tell you, like, the budget schedule. We're still on schedule for the budget, the entire fiscal year 21 budget process. the month of April is where we do all of our analytical work and we meet with other departments. And then by the end of April, we hope to have a balanced recommended budget to start going over with you all. And then after that, we will be having a constant yield hearing on May 19th, and that's when we'll have the budget hearing as well on May 19th. And then we hope to adopt a fiscal year 21 budget on June 1st if everything goes well. So that's where we're at as of today.
All right, any questions for Scott? All right, hearing none. Thank you, Scott. Really appreciate it. Thanks for all your work on everything and keeping your eye on this.
Yes, my pleasure.
Next item on the agenda is a discussion on TV market modification. We've got a lot of feedback on this already as soon as this hit as soon as the agenda was put out. The request, we were approached by some citizens to have the FCC look at a TV market modification. And what that means is, and first and foremost, I really appreciate all the emails that people send and try to clarify things. A lot of people read things on social media that get blown out of proportion or aren't accurate. And I appreciate those people that take the time to reach out and try to clarify and get the correct information. And certainly, I think I speak for Jim and Larry when I say, please feel free to do that at any time. First of all, there has been no decision made on that. There was a request to look into the FCC doing a market modification to leave Pittsburgh and join a Maryland television market. What that means, so that everybody fully understands, is as the law is written today, if we would attempt to gain a different set of TV channels, that would mean that we would be removed from the Pittsburgh television market and added to either Baltimore or Washington, D.C. television market. I believe personally, and I think Jim and Larry do, that if we were to do that, we would probably be in the DC market based simply off the fact that Allegheny County and what Cumberland's in and what they get is out of DC and not out of Baltimore. But that would mean that the TV channels that a lot of people here are accustomed to getting and from the information that we're getting would like to keep out of Pittsburgh would be taken away. So that's what's being asked of us right now, just so that everybody's sure of what's being requested. We've had Kevin look into it, and Kevin, correct me if I'm wrong. There would be, I don't want to say substantial, but there would definitely be a financial implication to this on our end to pursue that, correct?
Yes, that's not something we can do ourselves. We'd have to hire a firm that specializes in some of this. And I've seen estimates of $10,000 and higher to prepare the application.
Okay. So that's another piece of information that I think people need to have. The other thing, this isn't something that we would say we want to do this and it happens tomorrow. It's a lengthy process. And in the interim, one thing that we have done, because we understand that people that want to do this are claiming that because the governor's putting out information and so on and so forth, and we don't have access to Maryland news, we are at a disadvantage there. We have looked into MPT as a opportunity, if you will, to get Maryland news and to see if they would be able to broadcast the governor's press conferences, so on and so forth. They're not really set up to do that because we do get MPT out here. That's not really an option, but we did look into that. So that's everything out on the table of what's being asked. What we're doing today is getting that information out to the public, because I had a lot of people say, what does this mean? We have had a lot of people respond and say, hey, you know what? I don't want to lose my Pittsburgh channels, but if we can add a Maryland channel or add Maryland channels or give people a choice to get one or the other, there's seems to be a lot of interest in that. We've actually reached out to Congressman Trone's office. I spoke with him a while back on this and asked him that, you know, is there a way that we could get both? I mean, the problem is the laws haven't kept up with the technology. So, I mean, we know you can get the channels here because some people do it. But the question is, could you make that the norm where you would be able to get both or have your option? We have not received a response yet from the congressman on that, but he actually has been very responsive. So I suspect we'll get one soon. So between now and our next meeting in May, again, to that gccomments.org section, if you feel strongly about this, and I know a lot of you do, I think Jim and Larry and I have received a lot of emails. Some go to all three of us, some just go to one of us. You know, feel free, please. We want to hear your feedback. You know, send it to us or send it to GC Comments. Let us know what you think. And, you know, then we'll make a decision once everyone that has an opportunity to weigh in on this has an opportunity to weigh in on it. But mainly, I know there was some stuff on Facebook. We were going to vote tonight to take, and it was already done, and we're taking away Pittsburgh channels. It's not true. We did receive a request. We put it on the agenda to have discussion. That's what we're doing right now, to let the general public know exactly what this would mean. And we're soliciting your input. And we appreciate the many people who have already provided input. And then we will make a decision based off of that. Jim, Larry, either one of you guys want to weigh in on that at all?
No, I think you covered it very well. I mean, the ideal option is to keep Pittsburgh and add a Maryland station, and I guess we have to wait and see if, as you mentioned, we can get the help from the congressman to do that.
All right.
And I agree. What you said is pretty accurate, the way we all feel. I don't think we're going to do anything until we weigh all of our options, and then we'll make an informed decision, hopefully.
All right. Just a couple other announcements, and then see if anybody has anything else here. We have gotten a couple of emails regarding the issue that was being talked about right before we got into COVID-19, and that was on the Second Amendment Sanctuary County. We received a tremendous amount of input on that from when that was talked about. What we've said since then, and I'll reiterate today because I was asked about it today, specifically, is because that is such a big issue that so many people weighed in on, excuse me, and have strong opinions about. We don't want to make a decision on that in this format. We think we owe it to the citizens to be able to do that in a more public setting. So we hope that everybody on both sides of that issue appreciates that, that when we do have that decision made, you know, we're not doing it behind a virtual wall, if you will. So we don't know. You know, hopefully that'll be in the not so distant future as some of these restrictions are eased up, and at least we're able to get back into the courthouse together, the three of us, if not an audience, to be able to cover that. But it has not been forgotten. It has not been thrown out or anything else. We just had to kind of pause on that because we did not want to make a decision that so many people on both sides of that debate were invested in. We kind of put that on hold until we can get back together. Jim, Larry, do you guys have anything else to bring up at all?
I
I
I'd like to go on record as you did earlier in expressing our gratitude and thanks and for the health, all the people in the county that are working in the health services sector right now. I think they're doing a great job. And as Scott mentioned, even though this could have a pretty big impact on us in terms of the budget, I feel pretty comfortable that we're going to be able to get through this next year and a half without making any drastic cuts in the services or raising taxes or fees. So that's all I have.
All right, Larry?
No, I would agree with what Jim said. You know, I'm just thankful for all the county employees and the health employees, the hospital, all of them for all they're doing through this. So just thank each and every one of them.
And I echo that, and also want to thank all the teachers. It's a very trying time in the world of public education right now, and those guys are doing a great job of trying to keep kids engaged and navigate that. So I'll add them to the list as well, and hope everybody out there is staying safe. As mentioned earlier, our next meeting is May 4th. The agenda will be out probably. Kevin, we'll put the agenda up on our website late in the week before that.
Yeah, the agenda goes out the Monday before.
Monday before. So that'll be on our website if you want to check it out. And if nobody has anything else, I'll entertain a motion to adjourn.
So moved.
All right, we have a motion to adjourn. The meeting is adjourned. Thank you, everybody, and stay safe.